Good afternoon, everybody. It's Tuesday, our day to get together with all the families that come to the St. Louis Ark and talk about things that we think are going to be interesting in a 30-minute Q&A. And today is going to be a really fun one. You can see the screen is full because we've got our entire family navigation team here to talk to you about what family navigation is and what kinds of outcomes families are seeing when they come in and get some support from us. So without further ado, I'm Sharon Spurlock. I'm the Senior Director of Family Support, and I've got a lot of my team here today to talk to you about the work they do. I'm just going to say that this is a newer service that we've been offering to families, obviously, of all ages, and we'll provide this service for families regardless of what county they live in. It's funded by a couple of different county funds through the St. Louis County Productive Living Board and also through St. Louis Office for DD Resources. But we also use the money that we receive from the United Way and our own donations to pay for this service because we believe that families need to have access to one person who they can pick up the phone and call and schedule a one-on-one appointment with, whether it's for 15 minutes or for an hour, to talk about we have to plan for this situation that's coming up next week, next month, 5 years from now. And that's our job, is to help clarify what it is that people want to see happening and then help them make some plans to get there. And so in a nutshell, that's what navigation is. And we're going to introduce them by age range, not their ages, but the age of the people they support. So I'm going to start with Leanna Sanders, who works with our young families. Hello, Leanna. Tell everybody a little bit about yourself and your journey at the Ark.
Hi, I work with families who have kids 0 through 12, 13 years old. I started with my MSW practicum at the St. Louis Ark and got to be with family supports, and then moved into Capable Kids and Families as a family resource specialist, then assistant coordinator, and now family navigator.
Thank you so much. Leanna is a typical Ark employee that has dabbled, and so we're able to take advantage of all of her knowledge that she's built for young families. One of the newest members of our team who you maybe haven't met yet is Kate Carr. Kate is the next up the ladder working with our transition age families. Hi, Kate.
Hi, I'm Kate Carr. I'm fairly new to St. Louis Ark, but I'm not as new to navigation. I did navigation at a different agency, and prior to that, I worked at special school districts. So I've had a ton of experience with working with kids, young adults, and I really, this is like a big passion of mine. I love what I do. So.
Thank you, Kate. It's been great to have you on our team. Ann Mangelsdorf.
Hello, everyone. As Sharon said, my name is Ann, and I've been working with families I was thinking about it today, and believe it or not, it's probably been close to 50 years. I started as a teenager, being an assistant in a classroom during part of my high school education, and just love the work that I was able to do with kids with disabilities. And then since that time have done just a wide variety of things with families, and have been very pleased to work with families and learn as much as I can, not only from families, but from individuals with disabilities as well. So I feel like I found my niche with the St. Louis Ark.
And last but not least, Marianne Tolliver, who has more seniority at the St. Louis Ark than I do. Marianne, tell us about your professional path at the Ark.
Well, hi, I'm Mary Ann. I'm really happy to be here. And before I get to my professional time at the St. Louis Ark, I want to say that my first volunteer job was with a UCP summer camp at Babbler State Park. So even before I started working in the field, I had a little volunteer work as well. I started with the St. Louis Ark as a direct support professional working in the homes and residential. And then I moved into several different positions, from a management support manager position to a coordinator, assistant director. And then I was the director at our Dottel location for 20 years. And I just say that I aged in place with everyone that I was supporting, who really helped me kind of look at that whole aging experience for the people that we support. I had the privilege of assisting people who were in their final journey of life while they were receiving hospice services, and worked with families in that capacity, which was very much a privilege to be able to be there with individuals. And then after I left residential, I moved into this position as Director of Senior Services and Navigation of Residential Supports. And what I do in this position is, one, I work with our support staff in being able to educate them and give them more resources in working with people who are aging. And Ann and I, which we'll probably talk more about later, worked on a grant with the series that we call Planning Forward to really help families look at where they are today and where they want to be tomorrow, and the questions they may need to ask themselves, as well as their family member with a disability, so that everybody, one, is learning together and kind of talking about what they want their future life to look like. And so that was really successful, and it helps people to start planning now before they get into crisis. And Lord knows that that's really important, because when you need something, it never comes directly to you within this field if you're looking for support outside of the home. And then the other large part of my job is to work with families who have individuals who have either received a comprehensive waiver to move into residential services, and or people who may be able to private pay to work through the system and the whole transitional process for people to move into their new homes.
I'm going to take the lead from the first question, and we've got to kind of lead into our conversation. And they asked if we went by actual age or intellectual age equivalent of a person when we're thinking about this role of navigation. And for me, I rarely think about IQ and intellectual age, because it doesn't usually offer me any information that's going to be particularly helpful to the person as far as moving them through the things that they want to see happen in their lives. But it does make me think that there's a reason we chose to do this by age, and it's about some of the most common experiences that people have at different age pieces in their lives. So I'm going to open up the conversation. If you guys want to talk back and forth, feel free to, but I'd like to have each of you talk about what some of the key topics that come up because of the age range you're working with.
So a lot of times families will get connected with me, and the reason why I work with the 0 through 13 age range is a lot of families will get that first diagnosis or first delay in working with first steps, and they'll be referred to the St. Louis ARC. So I have knowledge for kids 0 through 13. So if they're looking for at-home intervention therapies, pediatric doctors, or any type of program that might be in the home, I'm able to connect them. We have wonderful resources such as Capable Kids and Families at the ARC, or other early intervention programs at other organizations that I'm able to help the family connect with.
Okay, so that's one really big moment in a family's life, is sort of wrapping their head around what it means to parent a child with a disability and be a family that includes disability.
Oh, and also the transition to kindergarten and preschool. So really meeting with the team and the parents at the same time to try to find those resources.
Okay, so you support families in an IEP setting?
Correct.
And Kate, you do that too?
Yeah, so that's part. So I work with the transition age young adults. So that could be what comes next after high school. And that can be quite a lot of different things. We're all different and we all need different things. And that's why there are different supports and different things that we can access once we're done with high school. So that is something, say the young adult is in high school, maybe has an IEP and it's not going well. That is something that I've done quite a lot. as an IEP advocate, because a lot of times in an IEP, teachers and just people that are in the meeting use phrases and words that are not really common knowledge. And it's not, to me, fair, because if you don't understand, or maybe there's a language barrier, we need to make sure that we're connecting everyone together so that we're here to not only help the young adult, but also the family as a whole. Yeah. So I can help a lot with pre-employment, continuing education. And then a big thing is accessing benefits and what benefits might be right for my loved one, and how do I go about doing that?
All right, I guess we'll just keep going up the ladder, Anne.
So my focus is on individuals beyond Kate, as far as age goes. And oftentimes that is, I'm so glad, Kate, that you brought up the idea of it's about working with the entire family, because it really is. And when we're thinking about families at that next stage, they are thinking about things like benefits too, but in a different way. Maybe they're retiring. And so they've always had that individual under their own insurance. Now they have to look at different types of benefits and insurance that their loved one might be eligible for. And so my navigation is a little bit different than Kate's, but there's overlap there. Also, I try to work with families around how to navigate the system. So it's almost like being a tour guide. And you are talking with a family, finding out what is their ultimate goal. What is it that the individual wants? What does the caretaker or primary caregiver want? How are they going to accomplish those things? And so sometimes when it's about advocating, especially when you're trying to advocate and navigate services through the St. Louis Regional Office / Department of Mental Health, that in itself can be confusing. So just even figuring out the process for appealing things or going up the ladder. Who do you talk to first? Who do you talk to second? You don't want to jump the gun and skip a couple people, because that creates problems. So just understanding next steps. And sometimes my navigation has just included being there and saying, yes, you're on the right track. You're doing the right things. Keep it up. Next step. All right, what are we going to do now? So oftentimes we are not only tour guides, but cheerleaders. So you all are the ones that end up doing a lot of the work, but we're there to help you figure out where to go next.
Yeah, I love the way you describe that. I've done some life coaching, and it's really about helping the person solidify their own goals and then helping them move towards them and stay accountable. And so I think a lot of families find that to be a really helpful part. I am going to turn to you now, Marianne, because what you do is quite a bit more focused. Which people are the people that you are doing navigation with, and what do you see your role with them being?
Mostly the people that I am working with are people who have received the comprehensive waiver through the Department of Mental Health / the St. Louis Regional Office, and working with the families to really look at what are the services that are provided in residential, have them meet and tour different homes. So you're going to meet the people who live in the homes and tour the homes to get a feel whether or not the people who live there would be, a good match as a roommate or a housemate for your family member. And that's a big piece of what I do, along with the facilitation of the transition meeting, which is facilitated by the Department of Mental Health. But at the same time, there's a huge role of assuring that it happened and of a lot of things that happen after that fact.
So I'm going to just butt in. I have to ask this because I think families think, oh, I have the waiver. all my problems are solved now. And why would I need to come through a navigator? And I know you've got the history of having been in the residential director role previously. What do you see as the gap? Why do we need to have some support for the family once they already get this funding to get the right residential placement?
Well, I mean, I think that right there, that says it all, the right residential placement. What does that mean? What does that look like for your family member? What, many of the things that you want to look at when you're looking at different providers is what their philosophy of the agency are, what's the turnover of their staff, a multitude of other pieces of getting out in the community and doing the things and living the life that your family member wants to live. But it's also getting to know people before you move in. It's a huge move, as you know, when you're moving. If you've lived at home all of your life and now you're moving into a home with some other people that you don't know, you want to know them before you move, or at least have some good interaction so that it's not just hello. Well, here you are in your new home. So there's a lot that goes in between that, as well as looking at funding and whatnot. I do work with a lot of families before they receive that comprehensive waiver, and one assuring that they're able to provide the information to their support coordinators to really help them move that process along. So a lot of times I'm like, hey, Kate, this person is for you. It's the wrong age for me. And sometimes it'll be more direct navigation that needs to happen. And I'm sending forward someone to Anne. So sometimes I do pass people along, but there are some people that I am able to provide some of that direct navigation to.
Thank you for clarifying that. I think that's really important too, because we want you to be talking to the right person. And if you've got a few steps to take on your journey before Mary Ann's the right person, you should be working with somebody that can help you take those steps. So this is a completely free service that you can roll in and out of. So you may feel like you want to have some family navigation and preparing for a meeting. So you can contact us and we can help you get ready for that meeting. And then you don't need to do navigation until there's some other reason to do it. So you can just leave. Or you may be working with us for an extended period of time, putting some steps in place to get your family member ready to get a job or to move into a different housing situation. And that might happen over the course of quite a few months. So it's a very open-ended service. You do not have to be referred by the Department of Mental Health. And again, there's no cost to you.
And the other thing I'll just say is that sometimes, depending on the age of the person that you have, that and whether or not they might need to use who for what. My child is 13 and a half. So where should they go? A lot of it is going to depend on what is needed. So sometimes people just have a quick question or need a resource. Sometimes people need to work on an issue that's going to take several months. So it really does depend. And there is a handoff between all of us. And also there is a lot of back and forth in terms of brainstorming and just sharing resources with each other. So it is fluid. And I know some people like black and white, but it is fairly fluid with some flexibility. And I'll just say that I have worked with a number of different families and watched them change and grow. One family that I worked with, this has been many months ago, they have 2 adult sons. And those sons are very different from each other, but they wanted to stay together, even though they had some similar and some differing needs. And a group of parents got together and started looking at alternatives to what was being offered. And now, as a result of a combination of a lot of work on the family's part, just making their plans and figuring out what makes the most sense, and their sons trying to figure out what they wanted and what they needed. And that was new for them because no one had really had those conversations before. So actually having those conversations that just were created out of some pointed questions, it has allowed them to now, these two men are going to be moving into their own apartment with supports. So that was one of the goals that they had. Another family that the success story is not over yet, but she has been a real powerhouse. And she's someone that all I do is just say, okay, I think the next person you need to talk to is the supervisor. Let's find out who that is. And then she writes the notes, she makes the phone calls. Sometimes we're together, sometimes she's on her own. But basically, she's at that point where she is going to get what she wants for her son because she is learning how to move forward with each step. And she has now included her state representative. And boy, as soon as she CC'd him on the email, things started to happen. But she also learned that you don't go straight there. You really do have to walk your way through the process. And sometimes it takes time and patience. But she is so much more knowledgeable now and confident because of the work that she's done with just some good listening and support from me. So that have been some examples of how navigation can work. And it can be as simple as just learning, your family member learning how to become more independent within your home. Or it can be other things as well, figuring out benefits, figuring out next steps after school is over. Maybe it's been several years and now that your family member is hanging out on the couch. And so it's time to look at what else might be out there for them. So there's a lot of ways that we can be involved.
So it sounds like in that situation, your role as a navigator was really listening and affirming for her that she was taking the right steps along the way. All right, who else has got a story for us?
So this is a little bit outside of what common navigation is, but I had a family reach out who had a child with a mental health crisis, and they did not have, they had TRICARE for insurance, and it was really hard to access mental health care with that. So I was able to help walk them through getting Medicaid and also accessing outpatient mental health care as well. So that is also something that we are able to assist with. And then also part of navigation is walking that family through advocating for their child. Kind of what going off of what Anne was saying, we do a lot of empowering parents to ask for resources and IEPs and what they feel like the therapies and services their child should be getting. So a lot of times we will accompany the parents and kind of have little meetings beforehand to discuss how to ask for something. And we'll be there to ask for it as well, because those can be really intimidating meetings, especially how Kate was saying, there's a lot of verbiage that's used that's kind of confusing. So we are there to help advocate alongside you.
And everybody knows how hard it is to get through the door of some of those systems. So that's a great example.
One story that I think has been life-changing for a family that I helped with navigation is was out of school, no fault of the families at all, and was going nowhere with the district. There was there was a language barrier, but also the verbiage that's used in an IEP and informal meetings is not always common knowledge. And especially if you use acronyms and, that's not always something that we know, everyone knows. And so making sure that you're also like taking in, okay, who am I talking to? I'm not talking to, a mental health professional. I'm talking to a family and I need to get on their level and their needs and meet their needs. And make sure that I'm explaining everything correctly, but then also asking them, does this make, having a fluid conversation. So long story short, the parents were trying to get this young man into school, and it took quite a while, but he has services now. And I talked with them the other day, and their son is so happy and he's so proud of himself. And he's like, I'm happy to be back, and his voice is coming back. And just seeing in the parents' eyes that, you know, he's able to get services and he's able to make friends and meet new people. And the unfortunate thing is this can happen, you know, and kids and young adults can fall through the cracks. And then it's like, what do you do? So that was really a happy story to find. And then I'm working with another young man that was really interested in ABA therapy to help with not only school setting, but at home. And to me personally, I'm not like true ABA. I like it's very natural environment, because what we don't realize is we all use it in everyday life. It's a routine. It's getting used to structure, but it's more pronounced in when you have a classroom or therapy. And so this young man has started using ABA in routines, and behaviors have gone down, able to communicate when something's happening, when he's hurt, when he's mad, instead of hitting something or maybe hurting himself, which the small things, those small changes that maybe get overlooked, those are some of the most amazing things, because it's those little things that add up to make everything.
So as a navigator, how did you support him and his family to get the ABA services that he needs?
So I have a lot of contacts through various agencies. And what I can do is I will help the families kind of bridge a connection. So if we're meeting in person or over Zoom, I'll ask, do you want me to be on like a phone with you where you're talking and I can kind of help facilitate, or do you need some advice on what to ask for? And then just knowing, will it be in my insurance? And so that's something that I have all written down, is what insurances each agency accepts. And a lot of times ABA doesn't really go over a certain age. So I have child and adolescent as well as adults. And then who can do, you know, group setting or in home. So that was kind of helping which one would be the best fit for their son and their family.
Yeah, I think a lot of times it's one of the things we use as a rule of thumb here at the ARC is that we want families to have enough knowledge to make a decision they feel good about, enough connection to other people to feel confident in making those decisions, and then actually being able to find the resources. And I think this navigation piece bridges all three of those, because we're able to make sure that, you know, here's the list of all these providers, but let's sort out which one's going to make the most sense for your family, not just because of insurance, but because the style of therapy they deliver, or how, you know, navigating a waiting list, or maybe it's even the gender of the provider. Sometimes kids have a preference for those kinds of things. So we can help sort those things out and help you move through those processes more quickly. All right, Marianne, last but not least, I'm going to let you wrap us up with a good story.
All right, so I had an individual who we had been working with for a couple of years, and his family and he were very interested in residential supports, but they ended up before, well, let me just say that they had self-directed supports for a while, where mom and dad were looking for and finding different people to come in and provide those supports, and while the individual still lived at home, as well as going to a day program and some other things. Well, they got to the point where they were ready for their son to move, but yet they were still really anxious about that, and weren't sure that they wanted him to move out of the house, because they weren't sure how successful he would be, because he needs more space. This individual had autism, has autism, and really felt that he needed more direct guidance and more one-on-one support. So there was a whole, I'd say, totally different meetings that we had, which was one to educate the team on what his supports look like and how he communicated, and working with the support manager to assure that, he was very versed in what the supports look like. And then it was all during COVID. So being able to come and get into the house at that time was not as easy because we didn't want, everybody you have to keep your distance and whatnot. So we did a combination of some Zoom meetings, as well as I had made up a PowerPoint presentation of this is the home. These are the people who live in the home. And just to give him a feel for what this is so that he wasn't going in with not even having a clue of what he would be venturing to. And he moved in and he said that he was really happy. He'd been there, I think it was like a month and a half, and he was really happy with his supports. And he was so glad that he had moved out of the home, and that I think that the family also saw that the supports that he needed weren't as intense as what they thought that maybe they needed to be, and that he liked having his freedom and time to himself. So, that was a huge success story. And I just want to kind of piggyback on what Ann said of those two guys who were involved, who were moving into potentially this condo or house flat that was purchased and will be moving before long, that they were part of our Planning Forward group. So they really looked at all the different facets of life in trying to make decisions and see what is it that they needed to know to make a decision to get their family in that best spot.
And I'll just say that that's a part of the model that we use at all age levels, is that we know that we will never have the capacity to work one-on-one with every family at every decision point in their life, because that's not realistic. So we try to offer a really wide array of stuff that you can access whenever you want to, like our videos that are available on our YouTube site or our Facebook page, just quick information and referral calls, and then work your way up to more in-depth kind of experiences like our support groups, which each of these people on the call facilitate by age range and by other specific areas of interest, like housing or people that use augmentative communication. So we're trying to really tap into what you all are telling us you want to learn more about, helping you connect with families that have those same interests or are in that same life stage, and then being able to refer you to resources. So, so that's the method to our madness. I really appreciate the fact that you guys all took time to be here today and talk about navigation. I think it's for me, and having been in the field as long as I have, it's a game changer. It's always the work we tried to sneak in when we were supposed to be billing for some other service, and to be able to do this and invest time in supporting families is so important, and it's so exciting that we have the capacity to do this. So we're very grateful for the people that pay for that service. I hope you guys will reach out to us, whatever your needs are for your family member. And if you would like to see something happen that doesn't even exist, that's great, because maybe we will make something happen in the next few years. Possibility is really what we want to be looking at.